Welcome to WGU Prep YouTube channel. Access all practice questions. Health Information Law and Regulations. Practice questions with answers. Question 1. Which law protects the privacy of patient health information in the U.S.? A. HIPAA. B. ADA. C. HITECH. D. ERISA. Which one is the correct answer? The correct answer is A. HIPAA. Explanation. The Health Insurance Portability and Accountability Act, HIPAA, protects sensitive patient information and sets standards for healthcare providers and insurers to ensure confidentiality and security. Question 2. What does the HIPAA privacy rule primarily regulate? A. Employee benefits. B. Patient data sharing. C. Health insurance premiums. D. Medicare fraud. Which one is the correct answer? The correct answer is B. Patient data sharing. Explanation. The HIPAA privacy rule ensures that patient health information is protected while allowing the necessary flow of information for healthcare delivery. Question 3. Which of the following is required for a valid consent under HIPAA? A. Oral agreement. B. Written authorization. C. Anonymous reporting. D. Public notice. Which one is the correct answer is? The correct answer is B. Written authorization. Explanation. HIPAA requires written authorization from patients for the use or disclosure of their health information for purposes outside of treatment, payment, or healthcare operations. Question 4. Which of the following is a major consequence of non-compliance with HIPAA? A. Public awareness campaigns. B. Financial penalties. C. Tax reductions. D. Legal exemption. Which one is the correct answer? The correct answer is B. Financial penalties. Explanation. Non-compliance with HIPAA can result in significant financial penalties and legal consequences for healthcare providers and organizations that fail to protect patient information. Question 5. What is the purpose of the HITECH Act? A. Expand Medicaid coverage. B. Promote electronic health records. C. Regulate pharmaceutical companies. D. Control health insurance costs. Which one is the correct answer? The correct answer is B. Promote electronic health records. Explanation. The Health Information Technology for Economic and Clinical Health, HITECH, Act encourages healthcare providers to adopt electronic health records, EHRs, and supports the meaningful use of health information technology. Question 6. What does the HIPAA security rule address? A. Financial audits. B. Data protection methods. C. Healthcare access. D. Health insurance fraud. Which one is the correct answer? The correct answer is B. Data protection methods. Explanation. The HIPAA security rule sets standards for safeguarding electronic health information, requiring healthcare organizations to implement administrative, physical, and technical safeguards. Question 7. Which of the following defines the term protected health information, PHI? A. Only physical records. B. Any patient data. C. Verbal communications. D. Health data with identifiers. Which one is the correct answer? The correct answer is D. Health data with identifiers. Explanation. PHI refers to any health information that can identify an individual and is transmitted or maintained in any form, whether electronic, paper, or oral. Question 8. What is the purpose of the breach notification rule? A. To inform the public about insurance rates. B. To inform patients about health risks. C. To notify individuals of health information breaches. D. To disclose changes in healthcare laws. Which one is the correct answer? The correct answer is C. To notify individuals of health information breaches. Explanation. The breach notification rule requires covered entities to notify individuals when their health information has been accessed, used, or disclosed without authorization, as well as report breaches to the Department of Health and Human Services, HHS. Question 9. Which of the following does the HIPAA minimum necessary standard require? A. Data sharing with all staff. B. Sharing data only for specific purposes. C. Full access for all patients. D. Removal of personal data from records. Which one is the correct answer? The correct answer is B. Sharing data only for specific purposes. Explanation. The minimum necessary standard requires that only the minimum amount of PHI necessary to accomplish a task or purpose be accessed or shared. Question 10. Which of the following is a requirement for healthcare organizations under the HIPAA privacy rule? A. Provide free health services. B. Maintain patient confidentiality. C. Offer online appointments. D. Deny health insurance claims. Which one is the correct answer? The correct answer is B. Maintain patient confidentiality. Explanation. Healthcare organizations must maintain the confidentiality of patient health information and ensure that it is used and disclosed appropriately according to the HIPAA privacy rule. Thank you for watching. For more practice questions, subscribe to our website at WGUPracticeQuestions.com.